When we assess safety on a construction site, our eyes are naturally drawn to kinetic energy, falling loads, collapsing scaffolds, moving plant. These are acute hazards. They cause immediate, visible trauma to the human body. But the most pervasive threats on a site rarely break bones on impact. Instead, they dismantle the body and mind over months and years. These are chronic hazard vectors: continuous broadband noise, repetitive kinetic vibration, invisible radiation, and sustained psychological stress. NEBOSH Element 13 requires us to map and control these exact vectors. We divide them into two distinct categories: physical health hazards, which degrade cellular and systemic biology, and psychological health hazards, which compromise cognitive function and behavior. UK safety legislation does not treat occupational disease as a medical inevitability. The law demands that employers establish strict, quantifiable mathematical limits on human exposure. You are legally required to track the dose of the hazard. To pass the NEBOSH Construction certificate, you must stop treating health and safety as the mere distribution of personal protective equipment. You must prove to the examiner that biological degradation is a measurable engineering problem. We begin with acoustic degradation. The inner ear contains the cochlea, a fluid-filled spiral lined with thousands of microscopic hair cells. When a worker operates a pneumatic drill, the resulting broadband noise creates pressure variations that disturb this fluid. Sustained high-intensity sound physically crushes and destroys these sensitive hair cells. Once these hair cells break, they never regenerate. This noise-induced hearing loss is permanent. In the exam, you must clinically distinguish this occupational damage from presbycusis, which is the natural progressive deterioration of high-frequency hearing due to aging. This logarithmic curve demonstrates the physics of sound intensity. The decibel scale is not linear. An increase of just 3 decibels represents a literal doubling of the noise level. Adding a second identical machine next to an 80 decibel generator does not equal 160 decibels. It equals 83. Because sound scales exponentially, the Control of Noise at Work Regulations 2005 sets rigid thresholds. The lower exposure action value, or EAV, is 80 A-weighted decibels. At this threshold, an employer must assess the risk, provide training, and make hearing protection available to the workforce. The upper exposure action value triggers at 85 decibels. At this level, the employer must actively implement a program of control measures and enforce the use of hearing protection. The absolute exposure limit value, or ELV, is 87 decibels. A worker's daily exposure cannot legally exceed this ceiling, even when factoring in the attenuation provided by ear defenders. Relying solely on earmuffs is a failure of safety management. The examiner expects you to apply a hierarchy of acoustic controls. You must intercept the sound pathway through isolation, placing machines on rubber mounts, absorption, using acoustic screens, insulation, building mass barriers, damping, adding materials to stop metal vibration, and silencing, fitting exhaust mufflers to compressors. To verify these controls are working, employers must implement audiometric health surveillance. A pure tone audiometry test plots a worker's hearing threshold across varying frequencies. The classic signature of noise-induced damage is a distinct drop in hearing ability at the 4 kHz frequency, known as the 4 kHz dip. Catching this early prevents total impairment. Noise control requires calculating exact exposure times against logarithmic thresholds. You are engineering an acoustic environment to protect cellular biology. From acoustic waves, we move to kinetic transfer. Using percussive tools like this road breaker drives continuous mechanical vibration directly into a worker's hands. This kinetic transfer into the bones, joints, and vascular system causes hand-arm vibration syndrome, or HAVS. The human body is particularly susceptible to specific kinetic frequencies. For the hands and arms, the critical danger zone is between 50 and 150 Hz. Sustained exposure within this frequency range destroys the blood vessels and nerves in the extremities. This manifests as vibration white finger, or VWF. The clinical progression is distinct. It begins with trivial tingling and numbness. As the tissues are starved of blood, the fingertips blanch white in the cold. This is followed by reactive hyperemia, a painful red flush as blood struggles to return. In chronic cases, the permanent occlusion of vessels turns the fingers a dusky cyanotic blue, eventually leading to gangrene. To prevent nerve death, UK law sets a daily exposure action value of 2.5 meters per second squared and a strict exposure limit value of 5.0 meters per second squared. You cannot PPE your way out of vibration. Control requires technical and procedural interventions. You must install anti-vibration mountings, dress abrasive wheels regularly to prevent out-of-balance rotation, strictly limit trigger time with mandatory rest breaks, and ensure workers maintain their core body temperature, as cold acts as a vasoconstrictor. Every part of the human body has a natural resonance. When tool vibration matches that resonance, the destructive kinetic energy is amplified up to 4 times. Strict procedural pacing is the only way to prevent irreversible damage. The construction environment also exposes workers to electromagnetic energy. We divide this hazard strictly into non-ionizing and ionizing radiation. Non-ionizing radiation includes ultraviolet light from arc welding and the sun, infrared from hot works, and lasers used for site leveling.
These are surface-level hazards. They lack the energy to alter atomic structures, but they cause severe thermal heating, tissue burns, and ocular damage like arc eye and cataracts. Ionizing radiation is entirely different. Sources like gamma rays used in non-destructive well testing or alpha particles in smoke detectors possess enough energy to ionize matter. They penetrate deep into the body, knocking electrons out of orbit. This causes molecular changes, cell death, and genetic mutations that manifest as somatic effects like leukemia or hereditary chromosomal damage. Controlling sealed ionizing sources on site requires mastering a fundamental triad: time, distance, and shielding. Shielding must be matched precisely to the particle. Alpha radiation is large and easily absorbed by a thin sheet of paper. Beta particles are smaller and faster, requiring about 10 millimeters of perspex. Gamma radiation is highly penetrating electromagnetic energy, requiring dense materials like lead. The remaining controls are mathematical. You must minimize exposure time, because total dose equals the dose rate multiplied by time. And you must maximize distance, utilizing the inverse square law. Doubling your distance from the source drops your radiation dose to exactly 1/4. Not all radiation on site is brought in by testing crews. Tunneling and basement works frequently encounter naturally occurring environmental ionizing radiation in the form of radon gas. Radon is an invisible, odorless radioactive gas resulting from the natural decay of uranium in soil and rocks. Because the air pressure inside a building or substructure is usually lower than the pressure in the surrounding soil, the building acts as a vacuum, actively drawing radon up through cracks in the foundation. Engineering controls for radon include installing impermeable radon-proof membrane barriers during construction and utilizing subfloor ventilated sumps, small cavities equipped with electric pumps that actively extract the radioactive gas and safely disperse it outside. Radiation safety is not about guesswork. It requires mapping the specific energy wave to the exact physical barrier and enforcing mathematical time boundaries. NEBOSH Element 13 requires us to treat psychological degradation with the same rigor as physical hazards. We define work-related stress technically. It is the adverse physiological and cognitive reaction that occurs when demands placed on an individual exceed their perceived capacity to cope. To prevent psychological collapse, the Health and Safety Executive established 6 load-bearing administrative pillars, known as the management standards. These are demands, control, support, relationships, role, and finally, change. When workload demands are too high or a worker's control over their pace is too low, the cognitive load exceeds capacity, leading to fatigue, anxiety, and hypertension. Unmanaged cognitive load and excessive occupational stress frequently create secondary behavioral hazards. The most critical to site safety is substance abuse, as workers self-medicate with alcohol or drugs to cope with pressure. Substance abuse destroys physical coordination and severely impairs the split-second judgment required to operate heavy plant. Under Section 2 of the Health and Safety at Work Act 1974, an employer who knowingly allows a worker to operate under the influence is legally liable for failing to ensure a safe system of work. Psychological hazards also come from external sources, specifically workplace violence. This risk scales dramatically when we look at lone workers, those completing tasks in isolation, out of normal hours, or in remote site locations. This 2x2 matrix maps the specific risk assessment framework used to audit the potential for violence. The exact acronym is PTTP,
places, tasks, times, and people. We assess if the site is isolated, if the task involves security or dealing with complaints, if the time is late at night, and if the people encountered might be intoxicated or hostile. Lone workers have no immediate backup. Mitigating this risk requires strict administrative controls, implementing mandatory buddy systems, utilizing GPS tracking procedures, and establishing covert distress codes so a threatened worker can signal for help without escalating an aggressive situation. Fatigue, stress, substance misuse, and violence are not private, invisible issues. They are measurable operational vulnerabilities that will trigger systemic site failure if left unmanaged. A safe construction site is a controlled environment where invisible hazard vectors, noise, vibration, radiation, and cognitive overload are actively intercepted by engineered shields and time gates. To excel in your NEBOSH exam, you must explicitly link physiological outcomes to real-world exposures. You must connect the 4 kHz audiometric dip to the pneumatic drill. You must connect the vascular blanching of vibration white finger to the grinder. You must memorize the exact numerical legal thresholds. Know that the upper exposure action value for noise is 85 decibels, and the exposure action value for hand-arm vibration is 2.5 meters per second squared. And you must recognize that proactive health surveillance is the ultimate systemic backstop, designed to catch microscopic biological failures before they become permanent disabilities. Mastering Element 13 means proving you can identify the hazard vector, calculate its intensity, and engineer the human hazard interface to halt chronic degradation entirely.